What is cancer? What is cancer of the cervix? What causes cancer of the cervix? Is cancer of the cervix treatable? Is cancer of the cervix preventable? If you have ever asked any of these questions or are interested in having the answers, then you should sit back and watch this introductory video about cervical cancer. But first, let me introduce myself. My name is Ashley Julian. I am currently a second-year physician assistant student at South University in West Palm Beach, Florida. I was born and raised in Eagan, Minnesota, which is a suburb of the cities. When I was younger, I loved animals, nature, and all things science. The house that I grew up in backed up to a huge nature reserve and park. I spent a lot of time going back there when I was younger, and I was fascinated by all the animals and plants that it inhabited. When I started going to school in elementary school, I was fascinated by science classes, learning about how plants grow, how the earth seems to balance itself out, and how everything seemed to work together so perfectly. As I continued through school, I always imagined and dreamed that I would become a veterinarian, due to my love of animals and my caring nature. However, when I got to high school, that is when I took my first human anatomy and physiology class, and I quickly realized how I was fascinated by the human body more than anything else. I redirected my goals into becoming a doctor or a nurse. I wasn't sure exactly what I wanted to do, but I knew that I wanted to be in the healthcare field, and I wanted to help people when they needed it the most. When I was 19 years old, I started working in a very large hospital as a phlebotomist. A phlebotomist is a healthcare worker who goes into the patient's room, takes a very small needle and draws a little sample of blood in a tube like this big, and sends it off to the lab for different tests. Sometimes they take more than one tube. When I was working at this hospital, this is where I first learned of what a physician assistant is, and I instantly knew that it was the perfect career for me. A physician assistant is a highly trained, educated, and skilled healthcare professional that can work in all different specialties of medicine. Physician assistant, also known as PAs, are able to take a patient's history, do a physical exam, order diagnostic tests, order labs. They can also review and interpret the different imaging studies. PAs are also able to come up with a diagnosis for the patient's problem and help create a treatment plan for the patient. PAs are also able to prescribe medications and carry out office procedures independently. Physician assistants can do almost everything that medical doctors can do, besides perform a surgery independently. PAs will often have supervising physicians that they will collaborate with. The reason that I chose the PA profession was because that PAs often have more time to spend with their patients. I don't like to feel rushed because I want to make sure that I have enough time to get everything done that I feel needs to get done. PAs also have a very good work-life balance, which was important to me when choosing a career. Another plus is that physician assistants don't have to pick one specialty of medicine and stay there for their whole career. This is very attractive to me because I love all different areas of medicine, and I would love to be able to work in different specialties throughout my career. Some specialties that I'm interested right now include orthopedics, pediatrics, ENT, which is ears, nose, and throat, and women's health. Women's health has always been a very big interest of mine and something that I feel very passionately about. Growing up with two younger sisters and my mom, I feel very empowered by women and all that we are able to do and how far we have come. I am very proud to be a woman, and I'm so proud of all the women who have came before me and fought for our rights and got us to where we are today. However, there is still so much more that we need to do and overcome, especially lately with abortion laws and birth control laws being overturned and debated right now. I feel very strongly about a woman's right to make her own medical decisions regarding her body. This is why I decided to pick a topic regarding women's health for my senior capstone project, which is the biggest project that we do in PA school. I am working under the guidance of my professor, Kristen Smethurst, who worked in women's health for many years before deciding to switch over to work in PA education. My target audience for this project is women who do not get routinely screened for cervical cancer. This could include women with lower education levels who do not know that they need to be getting screened as often as the guidelines recommend. This could also include women with lower income levels, with lack of transportation to appointments, with lack of medical insurance, who cannot afford the out-of-pocket costs that come along with going to the doctor's office. Another group of patients with lower screening rates that this topic is directed at is those patients with a cervix who do not identify as a woman, such as a transgender individual or non-binary individual. These patients may feel uncomfortable going to the doctor or may not know what screening guidelines are recommended for them. My topic is about cervical cancer prevention. I am looking at if home self-vaginal swabs are able to decrease cervical cancer rates by detecting the virus that causes cervical cancer earlier. The U.S. Department of Human and Health Services have launched a large project, what they call Healthy People. Healthy People is a national effort that sets goals and objectives to improve the health and well-being of the people of the United States. Healthy People 2030 includes 358 measurable objectives, as well as research objectives. My assignment as a physician assistant student was to pick a topic that I cared about, research the topic, and discuss my research and my goals for the topic. The objective that I picked is to increase the proportion of females aged 21 to 65 who get screened for cervical cancer. The statistics from 2018 tell us that only 80.5% of women aged 21 to 65 are regularly getting their cervical cancer screening according to the guidelines. By 2030, the goal is to increase that number from 80.5% to 84.3%. Specifically, I am looking at how home self-vaginal swabs for HPV may increase the number of women who get screened for cervical cancer. My topic is about increasing the number of women who get screened for cervical cancer. First, we will need to talk about some very basic female reproductive anatomy. Then I'm going to explain what HPV is and how it can lead to cervical cancer. I will also talk about the signs of cervical cancer and how serious cervical cancer is. At the end of this segment, you should be able to explain where the cervix is, what HPV is, what causes cervical cancer, and how serious it is. Let's start by talking about some very basic female anatomy. The female body has many different parts that serve many different functions. We are only going to talk about 3 main parts. First is the vagina. We can think of the vagina as a tube, with one end being open, as we can see in this picture here. If we were to open up the hole and look inside, it would look like this. The circular part right in the middle is the cervix. This is the area of concern when it comes to cervical cancer. Here is a cervix without cancer compared to a cervix with cancer. We can think of the cervix as a separation between the vagina and the uterus, which is where a baby would grow if there was one. Now let's talk about cancer. You might already know what cancer is, but I'm going to give a very brief definition. Cancer is a disease that causes cells to grow abnormally without any control. These cells can continue to grow, they can spread to other parts of the body, and they can even cause death. Many different things can cause cancer, and sometimes there's no cause at all. Cervical cancers is one of the most common cancers in women. In the United States, cervical cancer is the 4th most common cancer in women. While this disease is almost completely preventable and treatable with routine screening, almost 300 women each year die from cervical cancer in Florida alone. It is important to note that if you do not have a cervix due to a total hysterectomy, you cannot get cervical cancer. Some women are more likely to get cervical cancer than other women. They might have what we call risk factors. Risk factors for cervical cancer include having sexual intercourse at a younger age, having sexual intercourse with multiple partners, a woman who smokes cigarettes, and a woman who has a weaker immune system, such as a woman who has had an organ transplant or a woman with a different type of cancer. What causes cervical cancer? Let's say we have 10 women who have cervical cancer. Almost all of these cancers were caused by something that we call human papillomavirus, which is called HPV for short. There are actually over 200 different kinds of the human papillomavirus, and about 40 of them can infect the genital area. Some types are more serious than others. These types are called high-risk types. Specifically, types 16 and 18 are known to cause cervical cancer in women. Genital HPV infections are very, very common. In fact, they're the most common sexual transmitted infection in the entire world, and almost 70% of people will be infected with HPV at one point in their lifetime. Again, some of these kinds are very low risk and are not to be worried, as your body will clear them on your own. Most people with HPV don't even know that they have it because there's no symptoms. HPV is usually harmless and will go away on its own, but some types, the high-risk types, can lead to cancer or genital warts. In a patient who has a cervix, HPV can cause abnormal growth of the cells of the cervix, which could eventually lead to cancer. You might be wondering, how does someone get HPV? HPV is easily spread from any sort of touching in the genital areas with other genital areas or the mouth. Can transmit an HPV infection from one person to the other if one of the people is already infected. Again, most people will not show that they have any signs or symptoms of HPV. This is why regular checkups and screening are so important, so that the infection can be caught early and watched if needed before it can progress to anything more serious like cancer. Let's say that someone has HPV, which again is very normal, and a lot of people have HPV without knowing that they have it. If someone has HPV, how would we treat it? Unfortunately, there is no treatment for the virus itself, but there are plenty of things you can do to stay healthy and safe. The high-risk HPV types is actually preventable with a widely available vaccine. One of the most popular HPV vaccines is called Gardasil 9. The 9 stands for 9 different types of HPV that this vaccine will protect you against. The HPV vaccine can be given to someone as young as 9 years old. Getting the HPV vaccine before you have any sort of sexual contact is very important and a very good way to prevent the infection. Even if you've already had sexual contact and you haven't had the vaccine, it's not too late. The vaccine is actually approved for people up to 45 years old now. Okay, I know that was a lot of information, but it was all very important, and I want to make sure that you're following along and remembering the important things that I'm talking about. So we're going to go through a few short questions to make sure that you're fully understanding what I'm talking about. I'm going to ask a question and then put up some answer choices here. You will have a few seconds to think about which answer you think is correct before I show the answer and explain. Okay, question 1. In this diagram up here, which part is labeled as the cervix? You will now have 10 seconds to think about your answer before I give the answer with the explanation. If you picked B, then you are correct. In this picture, we are seeing the inside of the vagina, what a doctor would see when they do an exam. The circle part that looks like this, which again we think of as the barrier between the vagina and the uterus, that is the cervix, and that is where we are concerned about getting cervical cancer. Okay, question number 2. What causes cervical cancer? Here are the answer choices. You have 10 seconds to think of the answer. If you picked D, then you're correct. HPV types 16 and 18 are most widely known to cause cervical cancer. Okay, question number 3. Do all types of HPV cause cancer? Here are the answers, yes or no. You have 10 seconds to think of the answer. Okay, the correct answer is no. Not all types of HPV cause cancer. If you remember, I discussed that there's over 200 different types of HPV, and about 40 of them infect the genital tract. So a lot of those ones do not cause cancer. Next question, how does HPV spread? Here are the answers. You have 10 seconds to think of the answer. The correct answer is B. HPV is spread through any sort of sexual touching, skin to skin or mucosa to skin, with any sort of genital areas or the mouth. Okay, last question. Is HPV type 16 and 18 a preventable infection? Either yes or no. You have 10 seconds to think of the answer. The answer is yes. Types 16 and 18 are included in the vaccine, the Gardasil 9, which will prevent you against that type of HPV infection. Okay, that's it for right now. Did you get most of the questions correct? If so, good job. If you missed a few of them, maybe go back in the video and try and listen to the parts that you didn't quite understand. Now, since we covered what the HPV virus is and how it's related to cervical cancer, we must discuss how we can test for this infection in someone's body and how often we should be doing these testings or screenings. There are two main tests that we use today to screen for cervical cancer. The first one, and the most common one, is called the Papanicolaou smear, which is called the PAP for short. This test looks at cervical cells and looks for any abnormal growths which could lead to cancer. This test was created in 1941, and since doctors started doing this test, cervical cancer rates have decreased tremendously. This graph right here can show that once we started doing the pap smear test, which is where the blue line is, how much the rates went down of cervical cancer. This is why it is so important to routinely get screened for cervical cancer. This test can be done at any primary care office or any women's health clinic. Places like Planned Parenthood also offer this test. The test itself is a short and very painless test. You will begin by changing out of your clothes and into a gown. You will then lay on your back on the exam table and put your feet in footrests. The doctor will use something called a speculum, pictured here. This is a plastic device that goes into your vagina and opens slightly so the doctor can see your cervix. Once the doctor sees your cervix, they will use a very small brush, shown here, to scrape a few cells off of the cervix. This scraping of the cervix does not hurt, and then they will take out the brush, and then they will take out the speculum, and that is it. It's over. It only takes about 1 minute, and it's not painful at all. It might be a little awkward, but your doctor will explain everything that they're doing while they're doing it to make you feel more comfortable. They will answer any questions that you might have before the test as well. Once the doctor has your sample, they will send it off to a lab where they will look at the cells under a microscope to look for any abnormal growth. This abnormal growth could be precancerous or cancerous cells, but if there's any abnormal cells, your doctor will contact you and they will let you know what the next step will be. If it is a low-risk growth, they will just have you come back in a year to have another pap smear to see if your body cleared it on its own. If it is high risk, they may want to do further testing. The current recommendations are for that anyone with a cervix that is aged 21 or older gets a pap smear done every 3 years as long as the results come back normal. If they come back abnormal, you might have to get it done more often. So that was the pap smear, or the pap test, and that is one of the ways that doctors will screen for cervical cancer. Another test is an HPV vaginal swab. This test looks for an active HPV infection, whereas the pap smear was looking for abnormal cells. The HPV test can be done also at a doctor's office or a women's health clinic, or they have self-swabs that you can also do in the comfort of your own home. If you get it done at the doctor's office, it will be similar to the pap smear, where you change into a gown, you lie on your back on the patient table, put your feet in the feet rest. The doctor will again use the speculum to look in your vagina, and they will do a quick swab of the vagina with a similar brush. If you do the test at home, you will take the swab and you will insert it into your own vagina, twist it around a few times, making sure to get all of the area covered. Then you will send it off to be tested. Now that we've discussed how these tests are done, You might be wondering where you can get these tests done. You can get HPV and Pap smears done at your local doctor's office, a community health clinic, the health department, or your local Planned Parenthood. If you do have health insurance, your health insurance will cover the costs of these tests. Depending on the plan, you might have a copay, but for the most part, it should not be very expensive. As I discussed earlier, many women face barriers to healthcare, and cost is a huge part of this. Some women with lower income, bigger families can't always afford doctor's visits or health insurance. This is where Planned Parenthood comes in and helps people out. If you don't have health insurance, Planned Parenthood offers payment plans or allow for many Americans that have low income to qualify for free testing. I will now show you on the computer how to make an appointment at your nearest Planned Parenthood for an HPV test or a Pap smear. First, you're going to go to PlannedParenthood.com, schedule an appointment. Then, you're going to put in your zip code to see the locations closest to you. You're going to scroll to the location that you want to go to, and you're going to see the different appointment times that they have that are going to load on the right. Once you see a time that works for you, you can do an annual wellness exam to get all of your testing and screenings up to date. Pick a date and time. And then you press continue as new user, and then you will add in all your information. If you're uncomfortable with having a doctor do this test on you, then I would recommend looking into the at-home HPV self-swabs. There are many different swabs that you can find on the internet, and I have picked my two favorite ones that I think are the best options, and I'm going to explain them to you, and I'm also going to show you how you can order them on your computer. The first one is called NewRx, which you will type into Google and then put HPV test after. You will then scroll down to the one that says newrx.com, HPV at home test with free delivery. You will then scroll down to where you can press request a test. You will choose where you live, and then you will set up your account with your information. You will agree to the terms. You will then fill in your gender, your sex, your birthday, your height, and your weight, and if you smoke cigarettes. And then you will answer 5 questions about if you have a vagina, if you've had an abnormal test in the last 3 years, if you've been diagnosed with cervical cancer, if you're pregnant, and if there's anything else to know in the medical history. Then it will bring you to the payment plan options. This test is $79 without insurance and $49 with insurance. Another good test option is called Everlywell, which you can find on Amazon for a discounted price. Currently, it's at $36 when it's normally $49, which is an amazing deal for this test. It is currently recommended that if you don't get Pap smears done and you would prefer to do the HPV testing, that women aged 25 to 65 get an HPV test every 5 years. You do not have to get a Pap smear every 3 years and an HPV test every 5 years. You could choose one route or the other. Or sometimes doctors will often do the HPV swab and the Pap smear test at the same time, which never hurts because they can look for both of them at the same time. If you do this route, you can do this every 5 years also. These tests are very important. As we talked about, having a chronic HPV infection with the high-risk strains of 16 and 18 can lead to cervical cancer. This cancer presents without warning signs, so it's often late when someone finds out that they have cervical cancer. This is why it is so important to get your screenings done to prevent cervical cancer. Regular HPV testing every 5 years or regular Pap smears every 3 years will significantly decrease your chance of getting cervical cancer. Okay, that was a lot of information too. So, to make sure that you're following along and that you understand all that I've been talking about, we're going to do 5 more short questions, and I'm going to put the answers here, give you a timer, and then we will talk about the answers. Question number 1, do you need to go to the doctor's office to get a pap smear done? Yes or no? The answer is yes. Remember, the pap smear test is where the doctor needs to put the speculum in your vagina, scrape a few cells off of the cervix so they can look at them under a microscope. This is not something that can be done at home and needs to be done in the doctor's office. Question number 2. How often should a person with a cervix over the age of 21 get a pap smear done? Here are the answer choices. You have 10 seconds to pick the answer. If you picked choice C, you're correct. Every 3 years, someone should get it done as long as they come back regular. Question number 3. Do you need to go to the doctor to get an HPV test done? Yes or no? This could be a trick question, but the answer is no, you don't need to go to the doctor. Doctors can do HPV testing, but you can also do an HPV test at home with a swab. Question number 4. How often should a person with a cervix over 25 years old get HPV testing done? Here are the answers. Here's the timer. If you picked the choice D, you're correct. HPV testing is every 5 years, whereas the Pap test is every 3 years. And the last question, do you need to get HPV testing done and Pap smears done? Here are the options. The answer is no. You do not need to get both done. This is nice because you can pick one or the other, whichever you're more comfortable with, and that is sufficient according to the guidelines. Okay, we've made it to the end of this very long but very informational video. It was a lot of information. We covered the basic anatomy of the female reproductive system. We talked about cancer, more specifically cervical cancer. We talked about HPV and how there are so many different kinds and which specific kinds are more likely to cause cancer. We discussed how having long HPV infections could lead to abnormal growth of cervical cells, which could then lead to cervical cancer. We talked about how HPV is spread and the vaccine that is currently available to protect you against 9 high-risk HPV virus subtypes. We talked about the 2 different testing options, the Pap smear and the HPV swab. We also talked about the HPV self-swab at home, and I took you through step by step on how you can order them to your house today. After hearing all of this information, you now have the knowledge to make educated decisions regarding your healthcare. It is so important to be educated about HPV and cervical cancer. As I mentioned, this is a mostly preventable disease, and doing screenings will catch anything abnormal before it gets too serious. Thank you for watching this video. I hope that you learned some valuable information today that can help you make good decisions about your healthcare. I hope that you can share this information with other women who may not know all of the current screening guidelines. And I hope that if you're not up to date on your screening, this video gave you some insight on why you should go get screened for cervical cancer or HPV. I hope you learned something today, and I hope you enjoyed this video. Thank you for watching.